I am so excited for this episode today. I have Dr. Spiegel in the house. How are you doing?
I'm fine, thank you. How are you?
Oh, I'm just so impressed with your background, with the wealth
Thank
of knowledge that you bring the world. Can you tell the listeners a little bit about yourself and what you do?
Well, is it Karolina? Karolina, I want to say
Karolina.
Karolina, that's what I thought. I'm with a Wilson professor and associate chair of psychiatry and behavioral sciences at Stanford University School of Medicine. I moved out to California for a year in 1975 and never left. So I've been at Stanford ever since. I do research on hypnosis, mind-body treatments, helping people with illnesses like cancer, and post-traumatic stress disorder, people dealing with trauma. And I do research, I write grants, I write papers, and I take care of patients too. I set up the Stanford Center for Integrative Medicine in 1998 as well. So I try to help people dealing with either life stressors or medically stressful illnesses and see what I can do to help them.
Ooh, well, I have so many questions to ask you all about those things, but
Sure.
I'm just curious, how did you get into this work? Where did your life story lead you here?
Well, it's something of a genetic illness in my family. Both of my parents were psychiatrists and psychoanalysts, and they told me that I was free to be any kind of psychiatrist I wanted to be. So here I am. My father in particular was in combat in World War II in North Africa. Before he left, there was a Viennese refugee, a Jewish refugee from Europe, who couldn't serve in the military here, but had learned to do hypnosis as a young doctor. It's interesting, he had smallpox, and he had a big scar right on his forehead. And he noticed when he was a forensic psychiatrist, when he was interviewing prisoners, that some of them would just stare at the spot and kind of lean over and close their eyes and go into a trance state. So he got interested in these altered states of consciousness. And he then taught my father and lots of other Army doctors to use hypnosis for pain control and wounded soldiers in combat to handle stress reactions. And when my father came back, he went back to his psychoanalytic training. But he found that he was getting better results sometimes with a few brief sessions of hypnosis than he was talking to people 4 or 5 days a week on the couch. And I got to watch him make films of some of these patients. They were very interesting people who had seizures, and they'd start to seize, but they didn't have a real seizure focus in their brain, and treat people with trauma, help people stop smoking, help people with substance use problems like alcohol. And my first hypnosis patient in my career, I was at Children's Hospital in Boston. And the nurse said, Spiegel, your next patient is in status asthmaticus, and she's in room 347. And I'm just following the sounds of the wheezing down the hall, excuse me. And I walk in the room, there's an attractive 15-year-old redhead, bolt upright in bed, knuckles white, struggling for breath. Her mother's standing there crying. And I didn't know what else to do because they tried injecting epinephrine. It hadn't worked. They were thinking of putting her under general anesthesia, which is pretty serious, and starting her on steroids. And so having taken a hypnosis course, I said, well, would you like to learn a breathing exercise? And she nods. And I got her hypnotized. And then I realized we hadn't gotten to asthma in the course yet. And I thought, what am I going to say now? So I came up with something very clever. I said, each breath you take will be a little deeper and a little easier. And within 15 minutes, she's lying back in bed. She's not wheezing anymore. Her mother, who'd been standing there crying, had stopped crying. The nurse ran out of the room. The intern came looking for me. And I thought he was going to congratulate me on whatever it was I did. And he said, the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent. And, you know, Massachusetts has a lot of weird laws, but that's not one of them. And he said, and you're going to have to stop doing this. And I said, why? He said, it's dangerous. I said, you're going to put her in general anesthesia and then give her steroids, and you think my talking to her is dangerous? I said, tell you what, take me off the case if you want, but until you do, she's my patient. I'm not going to tell her anything that I know is not true. So over the weekend, it was a Friday, the intern, the resident, the chief resident, the attending had a powwow, and they decided on a radical solution to the problem. They said, let's ask the patient. I don't think that had ever been done there before. And she said, oh, I like this. She'd been hospitalized every month for 3 months in status. She did have one subsequent hospitalization, but went on to study to be a respiratory therapist. And I thought that anything that could help a patient that much, that fast, that safely, violate a non-existent Massachusetts law had to be worth looking into. And so I got, a real life lesson in the power of the mind to help the body. And I've been studying that ever since. And I've used hypnosis with about 7,000 patients and research subjects in my career. We've developed now an app called Reverie to make that available to people in my mellifluous voice to help with problems like anxiety, stress, insomnia, pain, stopping smoking, and controlling drinking as well.
Wow. I have so many questions to get into the meat of just, hypnosis and that mind-body connection, but I'm so curious. What was the feedback that you got from like the establishment at the time? You're in a very academic and medical profession, and here you are talking about mind body and maybe even hypnosis. We think of more as, something a little bit more woo, even though it has so much studies and credibility to it. So I'm just curious, as you went along in your career, did you get pushback?
That's an astute question. Absolutely. My chief resident, when I was in my psychiatry residency after medical school, I had my first patient had 200 shock treatments by the time she was 16, twice a week for 2 years, which I knew was malpractice. There's nothing, and they said it was due to her defiance of authority and the prevailing social unrest in her family. So I filed a complaint with the commissioner of mental health in Massachusetts, meanwhile getting told that I was acting out against my parents because they were psychiatrists or something. And I'm glad to say that they closed the hospital down. But I then tried to hypnotize her. I thought she's been traumatized, it might help, but she wasn't hypnotizable at all. And the only comment from my supervising psychiatrist was, did it ever occur to you that maybe that's because you're a lousy hypnotist? So it wasn't pleasant. I could laugh at that now. When you're just starting your career, it's a little harder to take. But I will tell you that one reason that I trained at Harvard. I loved the place. I learned a lot. And, a lot of people who do think they'll, stay there, rise up through the ranks and join the faculty there. And one of the reasons I left to go to California was that places like Stanford were a lot more open to whatever you can prove works. So, at Stanford, you kind of got a hunting license. If you can hunt up the support to do the research, go for it. It doesn't matter what it is. And I got some great colleagues here in psychology and biology to help me study stress responses and hypnosis. Carl Pribram, who is a brilliant neurophysiologist, gave me a spot in his lab and said, do some EEG and see what happens to the brain. And so I found it a much more open environment to explore something like hypnosis than fighting with psychoanalysts who are going to tell me that Freud gave it up. Who are you to use it? So you're right. I mean, there's skepticism everywhere, but it was a lot better in California.
Yeah. Well, it's just so insane how little we know and how much more we're learning, as a society and consciousness, and just to be open to the things like work that you said work are so tremendous. Okay, what is hypnosis exactly? How does it work?
Hypnosis, it's the oldest Western conception of a psychotherapy. It started more than 250 years ago. It's a state of highly focused attention. Have you ever, Karolina, had the experience of getting so caught up in a good movie that you forget you're watching the movie and enter the imagined world? You become part of the film, not the audience. That happens to you? That's a hypnotic-like state where you just narrow the focus of attention. It's like looking through a telephoto lens in a camera. What you see with great detail, but you're less aware of the context. You're less likely to judge and evaluate it. After the movie's over, you may say, well, that was kind of a stupid premise. And, but at the time you're in it, you're not evaluating it. And you disconnect, you dissociate. You put out of awareness things that might ordinarily distract you. So it's a kind of hyper-focused attention that you can use to develop a kind of cognitive flexibility. You can let go of old ways of thinking of problems and focus on new ones. You can also change your mind-body relationship. So a standard way that I, in my office and now with Reverie, help people with stress, for example, is I say, look, there's a stressor out there that's bothering you now. And one way it's bothering you is your body starts to feel uncomfortable. You know, your muscles get tense, you start to sweat, you breathe faster. And then you notice that and you think, oh my God, this must be really terrible. And then you feel worse. And then your body says, now he's getting even worse. So it's like a snowball rolling downhill. With hypnosis, you can go into this altered state and help your body relax. You say, imagine you're floating in a bath, a lake, a hot tub, or floating in space. Just let your body float. And you notice how quickly and easily you can use your stored memories, your imagination to help your body feel better. And then you can approach the problem. So you've already started to control one aspect of the stressor, the effect it's having on your body. And then you can begin to think, well, what's one thing I could do about this thing that might make it better? So it gives you a kind of foothold to change. And part of the way you know you're changing is you've changed your state of mind. And one simple example of that is if you make the mistake of reading a nasty email at 11 o'clock at night and you have trouble sleeping, you think, oh my God, what am I going to do about this? You wake up in the morning and you think, oh, that idiot, I know what to do. And you just do it. So changing mental states, which we have to do every night when we go to sleep and every morning when we wake up, is also a way of shaking loose your kind of fixed ideas about your situation, your problem, and what to do about it. And hypnosis is another kind of changed, altered mental state that can help you do that.
So it's like you're honing down on what's most important kind of through like a lens, letting all the other stuff kind of float away. And from there, you're able to come up with new solutions or, like I said, a new identity or a new approach.
That's exactly right. Well
And
said.
how would someone, like, how is a hypnosis session conducted to be able to elicit that? And, how does it compare? Like, we were talking about psychoanalysts before, just the idea of thought work. Are there certain ingrained either patterns or identity levels or measures that just you have to go below the surface a little bit to be able to make those changes?
Well, I think what you need to do is just shake loose your customary way of thinking about things. And maybe one way to explain it is to talk about what we've learned using functional magnetic resonance imaging about what actually happens in the brain when people go into hypnosis. And there are three things that happen that helps to understand how hypnosis helps you. The first is you turn down activity in what we call the salience network. It's a part of the brain in the deep, in the middle, and the front that is like an alarm system. You hear a loud noise that you think it's a gunshot, and suddenly your attention is over there and you're not doing this. That's your salience network firing. If you turn that down, which is what happens in hypnosis, you're less likely to be distracted by conflicting thoughts. The second is your executive control network in the prefrontal cortex becomes more connected to the insula, which is another part of the salience network that controls the mind-body relationship. So it's one reason that you have better control over how your body feels. You think about floating in a bath, a lake, or a hot tub, and your body starts to feel like you are. So you're enhancing control over your body. And the third thing is there's inverse connectivity between the frontal cortex and what we call the default mode network in the back of the brain, the posterior cingulate cortex. That's a part of the brain where when you're not doing much and you're just kind of ruminating and saying, why did he say that to me? Does he really not like me? Maybe I just wasn't smart enough. I wasn't this enough. That's that ruminative part of the brain about yourself. And when you're engaged in a hypnotic experience, you're turning that off. That's a part of the brain that over time, they've observed reduced activity with mindfulness. And you're supposed to, in mindfulness, kind of let go of yourself, not get over yourself, put it aside and just experience things. So hypnosis helps you dissociate from sort of standard concepts of who you are and what you can do and what you can't do.
Yeah, shakes up, like you said. I love the way you just described it. How would someone who's looking to stop drinking, how would hypnosis be a good tool to use in that context? And what is the difference between, the changes that you can make because of the hypnosis? Is it really the identity level that needs to change with that kind of a problem, or smoking cessation, anything like that?
It's the identity, but it's also the way we approach the problem with hypnosis. One thing that people who use hypnosis are fond of saying is the worst thing you can do is tell someone not to think about purple elephants. Gee, what do you think? So instead, you want to focus on what you're for. And when you do that in that highly focused way, you intensify your affiliation with it. So the kind of thing I say to people who drink or who smoke is, for my body, alcohol is a poison. Not for me, but for my body. I need my body to live. I owe my body respect and protection. Think of your body as if it were your baby. Would anybody who drinks put 5 ounces of vodka into the mouths of their baby? Hell no, of course not. Well, you know what? Your body is as dependent on you as your baby was. It has to take into it anything you put into it, even if it's damaged by it. And what this perspective allows you to do is affiliate with your natural protective urges, with your maternal urges to look after a baby or a pet, and to focus on what you're for, which is being a better caretaker for your body. And when you do that, 2 things happen. Number one, you can immediately feel better about yourself. Because you're affiliating with something you're for. You're not fighting drinking. You're not depriving yourself of anything. You say you may enjoy drinking, but it's not worth the price of what it does to your body. So you focus on what you're for, and you disconnect from your concern with, oh, but I always have a drink at 5 o'clock and always this and always that. You just turn that off and focus on what you're for, and you get the immediate positive reinforcement of instantly feeling not deprived, but feeling good about yourself and what you're doing.
Yeah. It's incredible how just one little mindset shift like that, or one different frame of thinking, can really change then the behavior and the patterns.
That's right. That's right.
What do we know about the mind-body connection? Like, what evidence do we have of, and I'm sure there's a lot, but like, what are your favorite things to share about how the mind and body play together and how the mind affects our body, all those kinds of things?
I want to assure you this is just cranberry juice, by the way. The mind-body connection is really a two-way street. If you think about it, what is pain, for example? Well, you stub your toe or you break your ankle or something, you'll get pain signals going through the nerves to specific regions in the brain, but it's the brain that interprets how much pain you feel and how it identifies it. So the pain is not purely a physical problem. It's a mind-body problem. The strain and pain lies mainly in the brain. And in the same way, how you control what you do is a top-down function. We decide what to pay attention to and what to ignore. Right now, if you're sitting in a chair, you have sensations in the parts of your body touching the chair, but hopefully you weren't aware of that at all until I mentioned to you. If you were, we can just stop now. But so your brain is making a choice that I'm more interesting than that, and you're going to listen to me for a while. So we construct an internal and external reality using our brain. We decide what to pay attention to and what not to. So if you're struggling with, a drive to have another drink, if you've been doing it for a long time, you can decide how much attention to pay to the craving versus the commitment to respect and protect your body and make a choice. And the narrowing of attention, the ability to control how your body feels, you can immediately feel better. You say, I'm feeling pretty good. I've got my body in a nice, comfortable, clear state right now. I want to keep it there. So you're making executive choices in a very focused and controlled way about what to pay attention to and how to respect and protect your body.
Yeah. And do you see it on the converse as well? So like, obviously here, this is a way we can elevate and our experience and have, more pain management and use the tools in a good way. So then do you see also the opposite of, some kind of toxic thinking or negative thinking leading to problems in the body?
Sure, absolutely. There are, people, one example that we're all living with to some extent, the coronavirus has made us all phobic about the world, and the more you avoid, you get anxious about being near something that makes you tense, the more tense you get when you do it. So it's an expectation that becomes a problem. And if you don't engage with the problem you're avoiding, it gets bigger and bigger because you don't have any good associations to it, just bad ones. So the narrowing of the and one other way in which hypnotic and dissociative-like experiences happen is when people are traumatized, sexual assault, and it's protective in one way, but can be a problem in another. Many rape victims experience the assault as if they were floating above their body, feeling sorry for the woman who's being attacked below. And that's a way of getting yourself through a terrible experience by kind of disconnecting from it. But unfortunately, it can also be a way of denying the reality of the threat that you have to deal with one way or another. And that's why, sadly, so many women with abusive husbands don't leave them. They think, if I'm just, he won't hit me again if I just make dinner right and I don't break a dish and all this stuff. And so they will stay near somebody that I wouldn't get within 100 yards of. So the ability to, it's an astute question, to manage your reality can be tremendously advantageous, but it can also be dangerous.
Yeah. And for someone like healing from any kind of trauma, what are your suggestions of processing through that?
Well, I try to help people see it from two different points of view. Again, use that same physical comfort. So even if you were being harmed then, your body is safe now. Just let your body feel safe and comfortable. I saw a woman recently who came from a country that is not famous for treating women well. And she sadly was raped by a landlord when she was 12 years old. And she said, it got worse and worse. I realized walking in the streets that my body wasn't my own. Men thought they owned me, She finally got out of that country. She worked as a health professional here, but she got more and more depressed. And I had her, and she was, frightened, tense, uncomfortable, depressed, unhappy that the man who raped her had not been brought to justice. I said, I want you in hypnosis, your body's safe and comfortable. I want you to picture yourself as that 12-year-old girl. Was it her fault? Because most sexual assault survivors blame themselves for things they didn't control. We'd rather feel guilty than helpless, and so she started to cry and she said, no, it's not her fault. She's just a sweet little girl. And I said, well, pretend you're her mother and what would you do? And she cries some more and says, I'm hugging her and I'm stroking her hair and I'm thinking what a lovely little girl she is. And she just changed her perspective about herself because she'd been told that somehow she could have prevented this or it shouldn't have happened. And she called me about a week later and said, Dr. Spiegel, my psychiatrist wants to know what you did to me. And I said, what do you mean? She said, I'm not depressed anymore. He doesn't understand it. And my friends don't recognize me, And so sometimes it can help you just get a new perspective on an old pain and get a clearer view of what really happened and kind of forgive yourself for something you shouldn't have blamed yourself for in the first place.
That's such an incredible switch. And, from feeling guilty to really feeling the nurturance that she could as kind of a mother-like figure now for the little girl version of herself. And I can see also that in that same example, almost like a hardened exterior, like, well, that happened, that didn't matter. Almost I'm pushing it away, So to really reconnect with the child that experienced that from a safe place, like you mentioned. Yeah.
Exactly. That's right.
It's so cool. So not only do you practice this and work with, 7,000 people, as you mentioned, but you also research it. So what is the research? How is the research proving that this works, it's effective? How does designing studies around this even look like?
Well, we did one study that we published in the Lancet in 2000 with a colleague in Boston, Elvira Lang, who's an interventional radiologist. And it was a randomized trial of surgeries where you cut down into an artery and you insert a catheter and you either open blocked arteries or you chemoembolize tumors in the liver or something. And it's pretty major surgery, but you don't use general anesthesia for it. So people are lying there 2.5, 3 hours with this cut into their femoral artery. And it's painful and it's scary. And so we had 3 conditions. We randomized people to 3 conditions. One was the standard care, which involved having a button that you could press with an IV and give yourself opioids. The second was that plus a friendly nurse comforting you and help reassuring you, encouraging you to control for just friendly attention. And the third was training in self-hypnosis. Your body is floating, safe and comfortable, cool, tingling, and numb, filter the hurt out of the pain. And at the end of an hour and a half of the surgery, the pain ratings in the standard care group were like 5 out of 10. There were 3 out of 10 with the nurse and 1 out of 10 with the hypnosis condition. I was afraid the hypnosis patients were all dying because they had no anxiety at all after an hour and a half. And it was 6 out of 10 for the standard care group. And the standard care group was using twice as much opioids as the hypnosis group. So they had twice the pain meds on, far more pain. The procedures got done 17 minutes quicker in the hypnosis group because the patients were more comfortable. But you know what? The staff was too. They were feeling better because the patients seemed so comfortable and relaxed. And they had far fewer procedural complications. So, you asked me earlier about prejudice about hypnosis. So I published this with my colleagues in the Lancet, the leading British medical journal. You would think that if you had an outcome like that with a new drug, every hospital in the country would be using it now. Well, I can assure you every hospital in the country is not using hypnosis for pain care. Dr. Lang has a company called Comfort Talk that is teaching nurses how to talk to and hypnotize patients. We've got Reverie now, but it's still a sort of a sideshow. And I want people to start thinking of hypnosis as being dangerously effective because it really works.
And from a hopeful perspective, like where would you love to see hypnosis grow into? Like where is it really going to thrive and where could we really use it as a society?
Well, I've decided, I've been working within the system my entire career, academic psychiatry and medicine and all that. And I'm going direct to consumers here. I've decided to bypass the middleman and just appeal to people. And if you look at integrative medicine, it's people who have 40% of Americans use some kind of integrative practice, acupuncture, mindfulness, hypnosis. They spend more money on it than they do out of pocket on medical care. They make more visits than they do for their medical care. They feel in charge. They're making a choice. And I want hypnosis to be available to anybody who wants to use it to help themselves manage pain, stress, insomnia, focus their attention, deal with problems like drinking and smoking, because it's quick, it's effective, it's helpful, and everybody should have the opportunity to use it. And so you can right now go to the App Store if you have an iOS phone, or go to the Google Play Store if you have an Android, download Reverie and use it to deal with the kinds of problems we've been talking about. So I just want it to be a standard health and wellness skill that anybody who wants it can use.
Yeah. I mean, just imagine the way that meditation has, started off as like very fringe and more, maybe hippie and then kind of really became mainstream over society. I feel like hypnosis really could have that same trajectory. Obviously, some people know about it and might use it, but that's a very small percentage.
From your mouth to God's ear, I hope you're right. I think that's exactly, that's what I'm hoping for. And, there's no reason why that shouldn't be the case. It's a safe, it's effective, it's rapid. I mean, one difference between hypnosis and mindfulness is meant to be a practice that you engage in rather than an attempt to solve a problem. Whereas hypnosis, it's more Western, it's problem solving. You want to sleep better, you want to control your pain without meds, you want to help in stopping drinking or stopping smoking. It's there for you and you can use it rapidly and effectively. So it can be a quick fix. I sometimes call it, a user's guide to your brain. You can just figure out how your brain can best control problems like these.
Yeah. Yeah. I mean, I see it, like you said, like pain management, any type of, disease or anything like that someone's experiencing, any kind of mental issues, whether it's like anxiety, depression, childbirth, but then also too, like what happens when you want to get to another level in your business or in your career or something like that. I can see how it can really ramp up that different perspective and different way of thinking that your brain was locked into at one level and get it ready for kind of the next step. So it's a great personal development tool too.
Absolutely. You can use it to prepare. There are athletes who use it now to practice, golfers who get tense with those final putts, who just calm and focus with hypnosis. So yes, it can be very helpful in just advancing the things you want to do. Sometimes it's problem solving. Sometimes it's just honing your skills and your ability to focus.
Yeah. Well, I have one more question for you. What is a myth about hypnosis that you would love to dispel?
Thank you for that. The myth is that in hypnosis, you lose control. Everybody, has the image of the silly stage show they went to and the football coach who danced like a ballerina and made a fool of himself and all that. It's not suggestibility, it's cognitive flexibility. So yes, we're all susceptible of influence by other people. That's why 70% of Republicans still think Trump won the election. It doesn't take hypnosis to hold on to wrong beliefs. But hypnosis is not fundamentally something that allows others to control you. It allows you to control you. You can enhance your ability to control both your mind and your body and be more flexible, control your perceptions, control your level of stress and arousal, and enhance your ability to focus if you want to and solve problems if you need to.
Yeah. Question for you, one more, I guess. Does
Sure.
hypnosis work if you're sleeping?
Well, that's an interesting question. The word hypnosis means sleep in Greek, and we talk about sedative hypnotic drugs as sleeping pills. But actually, and so in general, you're more relaxed in sleep, but which you often are in hypnosis. But your focal attention is kind of diffuse. However, I've been treating lately people who have what are called parasomnias, people who sleepwalk, get up in the middle of the night and wander out on the street or do something strange. And I've been able to use hypnosis to suggest to them that when they feel the bottom of their feet touching the floor, they're going to wake up. Because I think what happens with these is people sort of shift from dreaming sleep into a kind of hypnotic wakefulness without going through ordinary wakefulness first. And we have some indication that this works, that people are less likely to have these parasomnias when they have the hypnotic instruction, which means that in some way, even during sleep, they've made those connections and they respond to them. So in general, I don't find people being asleep as the ideal way to also get them hypnotized, but I think it is possible that hypnosis can play a role even during sleep.
Yeah. And I asked just because I think of like those, audios or just things that you put on often can make you sleepy. So just wondering if the effectiveness goes away if you actually fall asleep or not.
Well, yeah, in general, that's the case. And the whole, you are getting very sleepy hypnosis thing is old school. It's not what we do. Hypnosis is not sleep. It's a kind of focused attention. You don't have to take 20 minutes of getting bored to start falling asleep. You can shift into a hypnotic state if you have the ability in a matter of seconds or minutes, not many minutes or hours.
Yeah, absolutely. Well, thank you so much for sharing about the Reverie app. We'll definitely include that in the show notes below. And where else can people learn more about you and your work?
Well, we have a website, Stress Health Center at Stanford. We've published a lot. I've written a textbook with my late father called Transcend Treatment, Clinical Uses of Hypnosis. That's available from American Psychiatric Publishing. And we published a number of papers about hypnosis. If you do a search with my name in it, you'll find a bunch of them. So there are lots of ways to learn more about it, but you're welcome. Reverie, if you go to www.reverie.com, we have a number of papers there and research summarized to help you learn more about what's known about hypnosis from a scientific point of view, as well as a clinical one.
Yeah, well, definitely super interesting. We'll include all of those in the show notes below. Dr. Spiegel, thank you so much for sharing your wealth of knowledge with us today. I think there's so many insightful ahas that the audience had about, really how the brain can change, and that just because we have done something a certain way for so long or had a thought for so long doesn't mean that we're locked into that. There's ways to shift the brain, like you mentioned, and we just have to elicit these tools.
That's right. You put it very nicely. That's right. You can use your brain a lot more widely and effectively than you might have thought.
Awesome. Well, thank you so much.
You're most welcome. Bye-bye.